promoting health management of shrimp aquaculture on Guam and Commonwealth of Northern Mariana Islands. This presentation comprises of 3 parts. First, introduction. Second, principles and practices of biosecurity. Third, UOG's effort in enhancing regional aquaculture biosecurity, including Guam and CNMI. Since the 1970s, shrimp aquaculture has grown rapidly from 0 to 71% of the total world supply of shrimp, with a global annual production level exceeded 3.2 million metric tons in 2006. Epizootics remain the most catastrophic threat to the shrimp aquaculture industry, especially viral disease outbreaks. An example is that China, the largest shrimp producer in the world, was hit by yellowhead in 1988 and then white spot in 1992. As a result, its total production level dropped 2/3, and it took 8 years to recover. Similarly, shrimp aquaculture in Thailand and Ecuador, 2 other major shrimp producers, suffered greatly due to white spot outbreak as well. It has been estimated that the economic losses due to shrimp disease outbreaks had easily surpassed $10 billion. Major viral pathogens include white spot syndrome virus, yellowhead virus, Torres syndrome virus, infectious hypodermal and hematopoietic necrosis virus, and infectious myonecrosis virus. Now let's look at principles and practice of shrimp aquaculture biosecurity. The application of biosecurity, which has been widely used in livestock industry, has been introduced to aquaculture as a preventive practice for excluding specific pathogens from cultured aquatic species at different levels, from facility farm levels to regional and country levels. Biosecurity is the implementation of measures to avoid the entrance of new infection into a unit and to control the dissemination of disease within units, as well as to avoid spreading of infection to other units. Implementation of biosecurity measurements will help to protect the facility from the disease introduction, and the biosecurity audit is a very useful tool to examine how well those measurements are executed. Before we get to the priorities of a biosecurity audit, let's look at the inputs and outputs of shrimp units. The input is our focus, which includes the water, feed, broodstock, PL, gene dissemination, as well as people, supplies, and equipment. The good control of the input will determine how well the biosecurity measurements are. The biosecurity priorities are site location, water intake, fresh, frozen feed sources, introduction of shrimp or genetic materials, dispatch and loading procedures, personnel and visitors, so on and so forth. Biosecurity has to be closely associated with integrated health management, which includes implementation of guidelines for prevention, control, and eradication of disease, correction of disease-causing and disease-spreading conditions, as well as adoption and implementation of policies and regulations at different levels. Other than the biosecurity audit, shrimp health monitoring surveillance is an essential component of an integrated health management program at various levels, such as national, regional, and farm levels. In this current project, we focus on the farm-level health monitoring of the shrimp stock. Both the observations of shrimp clinical signs and disease diagnosis are important elements in assessing the health status of the shrimp stock. The basis of a good surveillance program are observant and skilled people with appropriate support resources who understand what is normal, are alert to change, and can describe the abnormalities they see. It is also essential for the aquaculturist to understand that the proper sampling size, tissue, and fixation methods should be followed so that the diagnosis can be correctly performed. For example, hemolith or pleopod would be ideal samples for detecting the presence of IHTV, white spot, Tora, yellowhead, or IMV by PCR, but won't be suitable for NHP diagnosis. Lastly, having the contingency plan in place is also critical so that the promote action can be carried out in controlling the disease outbreak and preventing further spreading of the disease. Now let's look at UOG's effort in enhancing regional health management in Guam and CNMI. Funded by USDA Center of Tropical and Subtropical Aquaculture, University of Guam took the initiative in conducting the biosecurity audit for the current shrimp facility across the region. In addition, shrimp samples were collected on site and then submitted for shrimp disease diagnosis. Guam and CNMI have a year-round warm climate. The natural seawater temperature ranges from 27 degrees Celsius to 29 degrees Celsius, which is suitable for warm water shrimp aquaculture. Currently, Pennell savannami is the sole Pennell shrimp species cultured in Guam and the region. There are 7 shrimp facilities in Guam and CNMI, isolated in the Western Pacific, yet within 4 hours flight time to major cities in Asia, where the center of world shrimp aquaculture production is located. The Mariana Islands have a unique geographic advantage and great potential in playing a more significant role in shrimp aquaculture, locally, regionally, and even globally. In addition to the steadily growing consumers' need for local shrimp meat production, there is increasing demand for specific pathogen-free shrimp broodstock from the Asia countries. These are some pictures taken from the biosecurity audit for this CTSA project. After biosecurity audit is completed for each individual facility, a site-specific executive report was generated. A brief summary of key components in biosecurity audit are listed in this table. During the biosecurity audit, shrimp samples was also collected from the 7 facilities in Guam and CNMI. Both PCR and histopathology diagnoses were performed by the Shrimp Pathology Lab at the University of Arizona. Despite the multiple advantages favoring shrimp aquaculture development in the region, the biosecurity aspect is absent in general, and the whole region is lacking health monitoring and regulatory control programs. In the past, biosecurity audits or similar efforts to collect the information across all the shrimp farms in the region and evaluate the current health status of shrimp facilities in the region haven't been done. There's a great need to increase the awareness of biosecurity measures at the farm level, as well as to establish a systematic health management to protect the whole region. from the introduction of viral pathogens and avoid the major disease outbreak. This effort would eventually lead to long-term sustainable shrimp aquaculture development on Guam and CNMI. UOG has spent effort in promoting regional health management by strengthening biosecurity in UOG hatchery, supplying specific pathogen-free canalsvinamide host larvae to local farmers, conducting biosecurity audits for farms in order to boost the awareness of biosecurity, and also establishing PCR capacity for shrimp disease diagnosis. From the information collected by the biosecurity audit and health surveillance program, there are three major aspects of the challenges in order to improve the biosecurity control measures in Guam and CNMI: the awareness, the resources, and the cost related to implementation of biosecurity management. Action on farm and regulatory government agency levels is required for improvement because it is really about protecting the shrimp aquaculture in the region, protecting what we have. Thank you for your attention.